What if healthcare was a privilege, not a right? Imagine a time when health bills were the #1 cause of personal bankruptcies, and access to treatment depended solely on private health insurance or the ability to pay out of pocket. This was the reality in Australia before 1984. In the late 70s, people who couldn't afford treatments like joint replacements had to live with the pain and disability. Life expectancy was lower, and many people often died without receiving the care they needed. Even those with private health insurance found themselves covered for only a certain number of days in hospital, and it often ran out during their stay. But in 1984, the landscape of healthcare in Australia dramatically changed. That was the year universal health insurance services, now known as Medicare, were introduced. Medicare was a significant shift, providing rebate subsidies for everyone, especially those who were finding it difficult to afford healthcare and families with children. This introduction led to a massive change in the accessibility of general practice. However, the road to universal healthcare was not without controversy. Introduced first as Medibank by the Whitlam government in 1975, it underwent changes and modifications by the succeeding Fraser government. But it was the Hawke Labour government that reinstated the universal healthcare approach in 1984, and on the 1st of February that year, Medicare services began. As the current health minister, Mark Butler, reflects, the program was fought tooth and nail by the Liberal and National parties and doctors' groups, who were initially concerned it would lead to struggles similar to those of the UK's National Health Service. Fast forward to today, as Medicare marks its 40th anniversary, it's a time for reflection. Is Australia's little green card meeting all its goals? While Australians love their Medicare card, they often only realize Medicare is paying for something when they hand it out, most often at the GP. So, let's summarize. The introduction of Medicare in 1984 revolutionized the Australian healthcare system by providing universal health coverage. However, the journey was not without controversy and opposition. Today, as we celebrate the 40th anniversary of Medicare, it's time to reflect on whether it is fulfilling its goals and keeping up with the changing health needs of the population. The evolution of Medicare is a testament to the importance of universal health care and its impact on a nation's health and well-being. As we look to the future, let's remember the past and consider how we can continue to evolve and adapt to meet the changing healthcare needs of all Australians. The story of Medicare serves as a reminder that healthcare should be a right, not a privilege.